Fearless Beauties, treating skin of color with confidence.
I went to get a laser hair removal and the receptionist told me they couldn't help me. They didn't have a laser for my kind of skin.
I went to get a chemical peel to help my acne, and I ended up with hyperpigmentation because the peel was too aggressive.
I wanted to get my hair cut and I went to the salon that advertised that they did ethnic hair. The salon owner turned me away, saying she didn't know how to cut my kind of hair.
I wanted a relaxing facial. It was my first facial and I was a little nervous. I didn't get a good skin assessment and consultation. The esthetician talked me into microdermabrasion and an enzyme peel on my skin. 3 days later, my skin was burning and raw. 1 week later, I was still burning and raw. 2 weeks later, my skin began to peel and flake.
My skin is tan. The esthetician was afraid to treat my darker skin with anything more than a basic facial. She didn't recommend any products to me to use at home because she wasn't familiar with how my skin will react to certain ingredients.
I went in for waxing and it was a hot mess. I had so many more ingrowns because my hair follicles are curved and the esthetician didn't know how to wax my kind of hair.
The purpose of Fearless Beauties is to change the aesthetic education in our country by developing curriculum that is inclusive of all ethnicities, races, and cultural backgrounds. Our second mission is to highlight entrepreneurs of color to increase their visibility and share their insight into success in the aesthetic industry. And our third mission is to become an influencer so that our online presence will move the needle towards equality. Today we're going to talk about why Fearless Beauties, common characteristics of skin of color, unique characteristics of specific ethnicities, questions to ask during the consultation, including transgender skin, treatment recommendations, and cultural appropriation. Aesthetic education has traditionally focused on teaching students how to care for Fitzpatrick skin types 1 through 3. And so discussion about treating any kind of skin of color is usually relegated to possibly a few sentences or a paragraph or two, telling the student that skin of color is challenging to treat and the student should take additional classes to learn about it. It's an advanced education topic. That has to change for several reasons. But our country is really in the fast lane as we're transitioning to a multi-ethnic identity. You can see from this graph here that in 1970, 77% of the population identified themselves as white. And now in 2015, only 38% of the population identifies their ethnicity as white. Our country is rapidly transitioning and becoming more and more multiracial, and those ethnicities will soon overtake Caucasians as the #1 skin color in the United States within the next 30 to 40 years. Additionally, our American cultural view of beauty is heavily Eurocentric. We have the idea that blue eyes and blonde hair are what is beautiful, and that women who don't possess those certain characteristics are somehow less than or are not considered as beautiful. For example, watch this video on the Shirley card, which shows you how the color film industry was developed, and colors were developed based on a woman named Shirley, the first woman, and matching her skin tones to what was considered appropriate skin colors. Additionally, our country's current political climate, including Black Lives Matter, and the need for social justice reform has really highlighted the equality gap that exists in our society today, and the beauty and aesthetics industry is no exception. So by developing curriculum that is accurate and provides education on caring for skin of color, broadens the educational base for aesthetic students, but it's absolutely the right thing to do. So look around. If you don't believe this is true, go ahead, look around and start to pay attention. Here's an example of a aesthetic school in the Midwest that held an Instagram contest asking students to recreate this look to win. And what are they recreating? Someone with blue eyes and blonde hair that they are determining is beautiful. Other examples of the beauty industry's lack of inclusivity include just the number of foundation colors that are available and have been available for years and years and years. And up until Rihanna came out with the Fenty line, where she expanded the foundation colors, did the beauty industry pay attention that there were that women of color had disposable income and money to spend on makeup and skincare and cosmetics. This map of the world shows you that the original human beings originated in Africa, and human migration about 40,000 years ago began from the center of Africa, and as our population began to migrate across the world, you can see that there was a group that went north and then they went to the west, where they ended up in Europe and northern European countries. There is a group that went south, where they ended up in the southern part of Africa. Then there's additional groups as they were looking to find sources for food. They ended up migrating northeast, ended up in Asia, where they went additionally north, crossed over the Bering Sea, came down into North America, or a group that continued east, where they ended up traveling and ended up over in Australia. The group that traveled across the Bering Sea into North America then traveled down through North America and into South America. And this migration has been proven with anthropologists throughout the years. As these groups of people traveled from Africa, you can see that their skin color began to change, and their skin color began to change the further they were from the equator. And that's because they didn't need the protection of the darker skin tones or of melanin that was protecting the nucleus in the skin cell. The skin began to lighten as they had less need for the melanin and a greater need for vitamin D. So light skin developed because it needed to absorb the UVB rays more readily for vitamin D production. They didn't need as much melanin because the sun rays aren't as high or as strong. For example, daylight in Sweden in January, the sun rises at 8:45 in the morning, but the sun sets at 2:55 p.m. This graphic shows you the common skin anatomy with the stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and the basal layer, along with the dermis and the subdermis or adipose layer. You can see the layer of keratinocytes on the top, and that is just common skin anatomy. But what we are going to do now is look a little more closely at some common skin characteristics of all skin of color, because it is really more than just melanosome disbursement. Although you can see by this graphic here that in darker skin tones, the melanocytes or melanosomes are down in the basal layer, but then they are really sprinkled throughout the layers of the skin, much more evenly spread out. You can see that the melanosomes are less spread out and much more concentrated in the basal layer, and then there's very few melanosomes that are dispersed up towards the surface of the skin in lighter skin tones. So melanosome disbursement in darker skin types is one of the common characteristics. Another common characteristics of skin of color is greater transepidermal water loss. And you can see that that definitely affects the skin barrier function. You can see that when there is a strong barrier function, those external irritants that come at the skin or that attack the skin are unable to penetrate through the skin barrier, and so keeps the moisture level intact inside the skin, and there's much greater hydration. So skin of color has greater transepidermal water loss, as you see with the graphic that is on the right-hand side of this slide, where you can see that the water loss, they have evaporation. It allows external irritants into the skin, so they have potential for greater irritation along with dryness and the water loss. Additional characteristics of skin of color includes post-inflammatory hyperpigmentation, and that is where any type of injury or pressure to the skin that causes an inflammatory response, the skin responds by producing and overproducing of melanin, giving some hyperpigmented areas. Additional skin conditions that skin of color face more commonly include melasma. Melasma is a form of hyperpigmentation, oftentimes caused from genetics and ethnicity, as well as hormones. Skin of color also has a tendency to scar easily, and so keloids or hypertrophic scarring is common. We are going to talk now for a moment about unique characteristics of Asian skin. After we've covered the previous conditions that we've discussed, remember that these conditions are also common in Asian skin, but here are some unique characteristics of Asian skin. Asian skin has a thinner stratum corneum. It also has the most eccrine glands of any ethnicity, but it has the fewest apocrine glands. The sweat does not have much of an odor. It has the least amount of facial hair, but the largest follicles. Asian skin is extremely sensitive to environmental factors and chemicals, and that will disrupt the skin's pH level. Asian skin has more sebaceous glands, and it's therefore oilier, but that means that the pores become clogged more easily, and so acne is an issue. 90% of Asians are missing the enzyme that digests lactose. So if you have a client that possibly has a diet that's heavy in lactose, you may ask them to consider a diet change and see if that makes a difference in eruptions in their skin. Let's talk for a few moments now about unique characteristics of black skin of African descent. Black skin of African descent has more keratinized cells in the stratum corneum. It also has larger sebaceous glands. The melanosomes in black skin have larger granules, and they have a deeper disbursement in the basal layer. There is more melanin, and so there's greater UV protection, and that results in the skin aging more slowly. Facial muscles have less movement, so there's a tendency, there's less of a tendency to develop signs of aging like creases between the brows or crow's feet. Black skin of African descent also may contend with dermatosis papulosa nigra, polycystic ovarian syndrome, uterine fibroids, pseudofolliculitis barbae, acne, and a vitamin D deficiency. You can see that dermatosa papulosa nigra, most commonly Morgan Freeman is someone that is well known with these black pigmented papules or dark pigmented papules on the face. And there really is no treatment for them. If you, they can sometimes be excised or removed, but when they're excised or removed, then that can stimulate post-inflammatory hyperpigmentation, or could stimulate the production, overproduction of scar tissue with keloids or hypertrophic scarring. African women are, black skin of African descent women are more common to polycystic ovarian syndrome, and that is a disorder where the cysts on the ovaries overproduce, and it can cause a number of metabolic issues, including irregular menstrual periods, higher than normal BMI, a very challenging challenging to lose weight, a male pattern hair growth, including loss of hair on the scalp, but then increased growth of facial hair. And so this is something that also affects the skin with acne production, as there is this hormonal disorder. Additionally, uterine fibroids are also common, more common in women with black skin of African descent, and that studies have shown that could possibly be due to the use of hair relaxers and causing an endocrine disruption as those chemicals are absorbed, those toxic chemicals are absorbed into the bloodstream through the scalp. An additional symptom of uterine fibroids is constipation. And so because bowel movements eliminate toxins from our body, constipation requires the body to find another way to get rid of those toxins. And those toxins are sometimes evident through eruptions in the skin, such as back and shoulder acne. Constipation may not necessarily cause acne, but if toxic waste gets trapped in the bowels for a long time, the toxins from the fecal matter will get reabsorbed into the body. This adds to the toxic load that the liver has to handle. And so oftentimes, one of the liver functions is to deactivate androgens, or hormones that stimulate the sebaceous glands to produce sebum. So if too many toxins are weighing the liver down, this affects the liver's ability to deactivate the androgens, which causes then hormonal acne eruptions, overstimulation of sebaceous glands, excess production of sebum and acne. It's just sort of a cascade of events that leads to an acneic problem. Additional issues are pseudofolliculitis barbae, and you can see where the curved hair follicle leads to the hair growing up and then curving and growing back into either that same follicle or another follicle, and then skin growing over that hair. The only real, the best way, the gold standard for treating pseudofolliculitis barbae would be laser hair removal with a 1064 ND YAG. Additionally, vitamin D deficiency is common, or greater characteristic of black skin of African descent. Let's talk for a few minutes now about the unique characteristics of Latinx skin. What exactly is Latinx? Latinx does not mean Hispanic. Latinx is a person of Cuban, Mexican, Puerto Rican, South or Central American, or another Spanish culture or origin regardless of their race. Hispanic really refers to language. So Hispanic refers to the Spanish or speaking Spanish language. So for example, Brazil is Latinx, but it is not Hispanic. In Brazil, people speak Portuguese. The Latinx ethnicities, skin tones are very, very diverse. Can be someone from a Fitzpatrick 1 all the way through to a Fitzpatrick 6. So what's unique about Latinx skin is that it has more granular mast cells. What are mast cells? Mast cells are the cells that are formed in our bone marrow that secrete histamines, that fight inflammation and provide immune protection. So Latinx skin has more granular mast cells, so it can recover more quickly from exposure to irritants. Latinx skin is not necessarily prone to acne, but the acne will be more cystic if it does occur. Latinx skin is very sensitive to benzoyl peroxide. Your Latinx clients have a greater chance of having diabetes. Diabetes will affect the blood flow to the skin because the body's unable to properly utilize glucose or sugar. That poor blood flow can affect collagen formation, It can affect oxygen and nutrients to the skin, that delivery system. The skin can become thinner and drier. Injuries may heal more slowly, and they may have a lowered immune response, so they may have a higher incidence of fungal or bacterial infections. Let's talk now about unique characteristics of East Indian skin. East Indian skin has many, many similarities to Caucasian skin. The oil gland and hair follicle distribution is very similar. The number of melanocytes is the same, but the melanosome production is second only to black skin of African descent. Paradoxical hair growth is a unique characteristic of Indian or Mediterranean skin. Paradoxical means contradictory. So what that means is someone who is having treatment for hair removal, it could actually cause the rare side effect of some fine hair growth instead. Periorbital hyperpigmentation is another unique characteristic of East Indian and Mediterranean people. Skin lightening and bleaching of the skin is really a cultural value that's been a holdover from the caste system, as well as English colonialism in India. There's even an app that can be downloaded on a person's cell phone that would lighten their complexion so that they would, it's being marketed to make you more attractive on social media. So shadism, which is a bias against someone based on the darkness of their skin, is very common in the Indian culture. Let's talk now about some unique characteristics of indigenous skin. Indigenous skin has epicanthic folds. Incisor teeth have a ledge on the back side. There can oftentimes be a gap between the front teeth. They will have very high cheekbones and lingual nodes, two bony pieces that protrude from the jawbone under the tongue. There's pigmentation evident on the back of the eye on the retina. There's fewer hair follicles on the body, but a larger number of follicles on the scalp. They also have fewer eccrine glands. Indigenous people are missing an enzyme that allows their body to process alcohol. Indigenous people have the highest rate of diabetes in the United States. They also have a tendency to have thyroid issues, and they think that may be possibly due to the use of tobacco. There was a heavy use of tobacco, and that use of tobacco leaches the skin or leaches the soil of iodine, and you need that nutrient in order for your thyroid to work properly, and so developing a goiter is a possibility just genetically. Acne is also an issue. Actinic prurigo is an abnormal reaction to sunlight that can cause papular or nodular skin eruptions. It's thought to be an autoimmune disorder that will start in pre-puberty, usually in young girls, although not exclusively. It often first occurs in the early spring or summer on sun-exposed areas of skin. And symptoms will include intensely itchy papulonodular lesions, skin redness. Predominantly it's on the bridge of the nose, the cheeks, and the lower lip, although it could be anywhere. Due to the intense itching, there can be some skin excoriations and scarring, also post-inflammatory hyperpigmentation. So indigenous people also are suffering from a high rate of rosacea that can go undiagnosed because it does not necessarily look like Nordic rosacea. There can be flushing and telangiectasias that are hard to detect because of the melanin in the skin, and the papules can be confused with acne or dermatitis. Let's take a look at some unique characteristics of Nordic skin. Nordic skin is typically fair, pale or ivory in tone. There's less melanosome activity, blue eyes, blonde or red hair, thin skin, and the skin ages faster. There's also a Viking influence from their travels in the 1200s, and so you may see someone who is called Black Irish, and they may have black hair, blue eyes, and very fair skin. People often think of the Vikings as quite fierce people, but they actually have a reputation for inventing the first comb, which they think was used to remove vermin from the beards. Common characteristics of Nordic skin include a very high incidence of malignant melanoma. You can see here in this graphic that Sweden and Denmark have the very highest rate per 1,000 people of melanoma. Additionally, what is sometimes called the curse of the Celts is higher incidence of rosacea, and that really just validates there is a genetic component in rosacea. Additional Nordic skin conditions include sarcoidosis, which would be red or purple-red rash, bumps usually on the shins or the ankles that can be warm and tender to the touch. There can be some disfiguring sores on the nose or the cheeks or the ears, and some nodules that can grow particularly around scars or tattoos. Ichthyosis is another genetic disorder characterized by dry scaling skin that can be thick or also very thin, but ichthy comes from the Greek root for the word fish. Now let's talk for a little bit about understanding transgender skin. Transgender clients really experience discrimination in the medical community due to ignorance and miscommunication. A couple of quotes we have here are, "My experiences in dealing with the police and hospital personnel after my rape was not pleasant and lacked a lot of sensitivity to trans issues." Finding doctors who will treat, prescribe, and even look at you like a human being rather than a thing has been problematic. Having been denied care by doctors in major hospitals so much, I now use only urgent care, and I never reveal my gender history. So you really are going to have to check your own biases when you are working with your transgender client, and make sure that you are coming across as someone who is accepting and non-judgmental in your relationships with them. Transgender is a broad term that's used to describe someone whose gender identity or gender expression doesn't conform with their genetically assigned sex. Cis is the word that's used to describe someone who identifies with the gender they were born with. For example, cis female. Cis is a Latin word that means on the same side, and trans is a Latin word that means on the other side. There are a lot of different terminology for the LGBTQ community, and we'll discuss some of those here. L stands for lesbian, a woman who's sexually attracted to another woman. G is gay. G stands for gay, a man who's sexually attracted to another man. Bisexual is someone who's sexually attracted to both men and women. Transgender is someone whose gender identity, expression, or behavior is different from those that are typically associated with the sex that they were assigned at birth. Queer is really an umbrella term for those who don't want to categorize sex or sexuality or their gender. Intersex is a person who is born with reproductive or sexual anatomy that really doesn't fit or can't be necessarily categorized as strictly male or strictly female. And then asexual is someone who doesn't experience sexual attraction. Gender identity is somebody's subjective sense that they are male, female, or possibly another gender. Non-binary means the viewpoint that gender is someone who has a gender that's outside either male or female. Gender expression is how a person communicates their gender. It can be vocal, as well as the clothing they wear, their behavior, maybe their body art, their hairstyle, how their body language expresses their gender. Sex is the assignment of male or female at birth, and that's based on chromosomes, hormones, or physical anatomy. Gender norms refers to society, cultural influences that determine what's appropriate behavior, dress, speech, profession, what is our society's determination of what's appropriate for these sexes. So you can have a discussion about what are some gender norms within our society or the community that you're living in now. Transsexual refers to someone whose gender identity is different from their birth sex, and they have either had a change or they want to change their sex, typically through medical intervention. Cross-dressing is a form of gender expression where a person will wear clothing that's typically worn by the opposite sex, but someone who enjoys cross-dressing may or may not be a transsexual or transgender. Transitioning from one gender to another is a complicated process, and that involves adopting clothing and grooming of the gender they identify with, and oftentimes includes a name change. And this is a photo of probably the last few years, someone who is a celebrity, very popular or very well known for transgender. So let's look at some of the differences between male and female skin as we get into discussing our transgender client. Someone who is male is going to have larger sebaceous glands that produce more sebum. They have larger pores. They're going to lose subcutaneous fat faster, so they'll have deeper wrinkling. They have 25% thicker skin than a female, and it will gradually thin with age over time. The collagen is much more densely packed, and there is thicker hair in deeper follicles. A female will have smoother, finer skin because the stratum corneum is thinner. Skin thickness will remain constant until menopause, and then there's a significant loss of collagen. There's less collagen support, and there's shallower hair follicles. A transgender client could be classified as male to female, which is using the acronym MTF, or female to male, FTM. Some clients may decide to undergo medical intervention. Others may opt against it, but it's extremely personal and it's a very costly decision. And so when you have your transgender client, you need to be aware of some disease and disorder differences, as well as some medication differences. There is a high cost of hormone therapy, and there is a lack of respect and some ignorance by medical professionals, and that's created a lot of black market use of illegal substances or illegal hormones. A study done in San Francisco with 314 transgender women, 49% of them admitted they were taking hormones that were not prescribed by a medical professional. Some cosmetic injectables are also common on the black market as clients try to develop facial features that may be more like the gender that they identify with. So oftentimes these black market injectables can cause infections or granulomas, and that is a granuloma is when your body tries to create a hard shell or a thickening around that foreign substance that's been injected. Also, male to female women have a higher incidence of the autoimmune disease lupus, and that's believed to be due to long-term estrogen therapy. So lupus has can have a severe onset and can really affect cardiovascular health as well as kidney functions. Male to female women also have a higher incidence of HIV and sexually transmitted diseases. So you need to be aware of that because just being cautious of bloodborne pathogens and avoiding any kind of cross-contamination. but also HIV can have some skin-related symptoms like fungal infections, seborrheic dermatitis, eczema, and also some very pruritic papules. In the female to male transition, testosterone is first used to suppress those female sex characteristics. This drug is usually given via a weekly injection, although there is a longer lasting drug that's sometimes used off-label, and that's given every 12 weeks. It's important that you consider, or that your client be aware of osteoporosis, as hormones are the hormones are really necessary for bone density. Medical professionals are going to be regularly checking your client's lipid blood levels to look for cholesterol changes. They're also going to be checking hematocrit blood levels, looking for red blood cell activity. The weekly injections for someone who is female to male transitioning could continue for 6 months to a year, and then your client will transition to implanted testosterone pellets. These pellets are then inserted under the skin into a fatty area of the body, oftentimes the hips or the butt. About a third of the pellet is absorbed in the first month, and then 25% becomes absorbed in the second month, and about a sixth of the dosage is absorbed in the third month. So then most clients are going to require reimplantation of pellets every 3 to 4 months. Within 3 months of starting hormone therapy, your client is going to have increased facial and body hair, increased acne, changes in fat distribution, libido, and muscle mass. Menstruation will stop. The voice is going to begin to deepen, and the vaginal walls are going to thin. Male pattern hair loss may also be evident. Breast reduction is usually the first surgery that your female to male client is going to undergo during transition. And there's a number of different surgical techniques that include repositioning the nipple and moving the breast tissue depending on the size of the client's breasts and the skin health. So your client is going to have some scarring due to that breast reduction surgery. Male to female clients transitioning are undergoing hormone therapy as well, and those hormones are going to change the fat distribution, reduce male pattern hair growth, increase breast size, and your client will experience loss of erectile function. Estrogen is the main hormone, but that has to be balanced with a testosterone inhibiting medication in order to work effectively. Spironolactone is a common medication prescribed to suppress testosterone. Spironolactone use has a side effect of high potassium levels, and so your client may experience some weakness, irregular heartbeat, some nausea, muscle cramps. That initial hormone therapy can take 18 to 24 months. You may have to consider these anatomical differences due to hormones and surgery if you're performing intimate waxing or laser hair removal. Your open-minded kindness and acceptance is really important when you're doing the best for your transgender clients. Here is some facial feminization surgery where there's some forehead contouring, can reshape the brows, typically a rhinoplasty, which would then thin the nose, and there can be some chin and jaw contouring that would soften the face, and then a tracheal shave. Now let's talk about the consultation. When you are doing consultation with your client, whether it is your client who has skin of color or your transgender client, or perhaps they're both, you are going to base your consultation on the physical exam of the skin, an in-depth conversation with your client, and reviewing the medical history. You want to review the health history very carefully. You want to ask your client about allergies. They might not list all of their allergies because they might think they're not important, or that you're only referring to allergies to medications. You want to talk to them about a number of things, but particularly you want to understand, do they identify as male, female, what was their sex assigned at birth, do they have a preferred pronoun? Have your client fill out the Fitzpatrick scale so that you can get an understanding of how your client views their own skin. You're going to still do your own skin analysis and determine the skin type, see if the two of you match. Do any of your treatments, you need to understand your client's occupation. Are they working outside? Are they working under HEV lighting where they need to have concerns about that? How their influences from their job could affect their skin. You want to talk to them about the treatment that you're doing. Have they had it done before? What was their experience? Are they using any skincare products that are prescribed by a physician? Are they perhaps on an antibiotic for acne, or are they taking a prescription Retin-A? Do they have a history of reacting to specific products or ingredients? You want to talk to them about how they scar. Do they have a tendency for hypertrophic scarring or keloids? You want to know how their skin heals after they've had an insect bite or an acne lesion to determine if they have post-inflammatory hyperpigmentation. You also want to ask them about stress in their life. When you're talking to them about a home skincare regimen, you need to know after cleansing in the morning, does their skin become oilier during the day? If so, when does it become oilier? The later in the day the skin becomes oily, then the less oily it is, or the earlier in the day, the more oily their skin is. How often do they experience a breakout? Is that acne breakout related to any hormonal triggers? How long does that breakout usually last? Ask them to walk you through their skincare routine. Ask them what they like most about the skincare they're using. Is it really doing what they want it to do? Is this the time for them to begin to transition to a different skincare line or different products that are going to be more beneficial to their skin? You want to ask them questions about their lifestyle. How often do they change their pillowcase? How often do they change their razor if they're shaving? What about the collars on their clothing? Is it rubbing against their jawline, creating an irritation and inflammation? Do they wear for their work or any kind of hobbies? Do they routinely wear helmets, caps, scarves on their head? Ask them about the use of a SAD light. Seasonal affective disorder clients could be using a 300 wavelength UV light to help with depression, and that could inadvertently be causing some pigmentation to the skin. Ask them about their menstrual cycles and review to make sure they don't have polycystic ovarian syndrome. If you suspect that they do, and you're not allowed to diagnose, but it's certainly appropriate to refer them back to their medical professional. Talk to them about their different activities, like hot yoga. Is hot yoga contributing to their melasma? Ask them about tobacco, smoking, and vaping, because smoking will limit oxygen to the tissues. Talk to them about cannabis ingestion. Cannabis is a hormone disruptor, and that limits the release of testosterone. So men who are long-term cannabis imbibers can develop gynecomastia or man boobs. Ask some questions about their diet, fast food, processed food intake, maybe their dairy and gluten intake, because remember, Asians have a high percentage of lactose intolerance. Ask them about their water intake and their alcohol intake. Alcohol can be very dehydrating to the skin. How much soy are they eating? Soy is a plant estrogen, and it can contribute to hormonal disruption. Ask about any herbal supplements. Some herbal supplements can cause some sun sensitivity, but clients may believe that because it's an herbal supplement, it's not a medication. They may not list it on their intake form. You do want to talk to them about their heritage. Do they have any skin of color in their family or their background? What about their parents, grandparents, great-grandparents? Consider any cultural influences. For example, oftentimes Black culture doesn't include discussion about sunscreen. Black clients may need education that Black skin does need SPF. Latinx has a high incidence of diabetes, and Nordic heritage may have rosacea. So you want to think about those cultural heritage, and could any of those cultural influences or ethnic influences be evidenced on their skin. Then you want to determine their Fitzpatrick skin type. And this chart, which is actually a genealogy chart, but you can see here that if their DNA, if they have skin of color in their DNA, it is going back for at least 6 generations. And so you've got to take that into consideration when you are making your skincare treatment plan. You want to talk to your client about healing time. Do they have any systemic medical issues like diabetes? Have they had their spleen removed? Do they have an autoimmune disorder? Talking to them also about their budget, because if budget is a concern, then you want to start with home care first. They're going to get 80% of their results from the home care that they're doing. 20% of the results are going to be supported by the professional skincare treatments that you provide. Start them on a serum and then add other products as their budget allows. Talk to them about their commitment. If they can't commit, then don't map out a long-range plan. You want to ask them questions about their timeline and what are their expectations for improvements so that you can make sure they've got realistic goals. Think about cultural influences, for example, the use of pomade or gels around the hair that could cause some hairline acne. You really want to use when you're creating your treatment plan, you want to use a progressive, not aggressive approach. You really want to rethink and make sure that you're moving slowly and methodically and with intent. For your treatments, you want to exercise the skin. You want to condition it so that it can accept increasingly more aggressive treatments. You can condition the skin with a series of treatments. Ideally, if you were going to be doing chemical peels, you would start with an enzyme peel first. And then if your client does well with an enzyme peel, you are going to increase to a large molecule peel with a low acid percentage. For example, you may start with a mandelic, azelaic, lactic, kojic, malic acid. They all inhibit melanin production, and they are all larger molecule peels. Then you would move to a glycolic peel once the skin is conditioned with the other larger molecule peels. The standard for treating skin of color for hair removal is definitely the 1064 ND-YAG. And then don't forget LED light. Skin of color responds very, very well to the use of LED. Skin of color can be very sensitive to retinols, and overuse of retinols can cause an inflammatory process, which then leads to hyperpigmentation. So you want to progress really slowly, building up to maybe 3 times a week, and have your client avoid harsh exfoliation. There's a lot of controversy about the use of hydroquinone, and that could be necessary for short-term use. You might titrate the dose of hydroquinone being used from 2% or higher till the client's hyperpigmentation fades, and then you would titrate them back down and onto a non-HQ melanocyte inhibitor, and then possibly they may have to go back on HQ to help if occasionally the melanin production gets out of control. And then you can see this graphic here. One of the reasons that hydroquinone is so controversial is because of the development of ochronosis with long-term HQ use. Let's talk for just a few minutes about cultural appropriation. What is cultural appropriation? It's really taking something without permission. If you appropriate something, you are taking it without permission. Now, there can be adopting another culture where you have appreciation for that culture. And this is an example of a designer who did appropriate the colors and designs of an indigenous tribe, and he actually paid this tribe for the use of some of the tribe's secrets in obtaining the colors of the fabric. And this is an example of adopting another culture without permission, where it's almost a mockery of this other culture's dress or hairstyles or makeup or even language. And so that is never appropriate. Cultural appropriation often happens with celebrities. You can see where they're adopting other cultures, either hair or makeup or fashion, without consideration or respect for that culture. There's often a cultural appropriation of black hair by white women. And this celebrity on the left was actually mocked walking the red carpet where the fashion police were mocking her use of her braids, yet Heidi Klum was lauded as being ethnic and edgy with her hair in a similar fashion. Geisha chic, Rihanna and Fenty Beauty came out with a color of cheek color called geisha chic, and as soon as it was pointed out to her that geisha was really considered an almost offensive term for a woman who is whose role is to serve at the pleasure of a man, that she immediately removed this, and so she had respect for that culture and immediately removed that cheek color from her makeup line. K-beauty is an example of a beauty culture that is really respectfully embraced. It's really ironic to have people of color facing a Karen who feels threatened by the color of someone's skin, but yet this Karen can endorse and adopt someone else's culture. So to really have an appreciation for beauty in another culture, we have to give credit to that culture as a sign of respect. This is something that really needs to happen in the beauty industry in order to make diversity and the inclusivity that we need. Nicki Minaj has said, if you want to enjoy our culture and our lifestyle, then you should also want to know what affects us, what's bothering us, and what we feel is unfair. You should not want to know that.
My skin is the color of cinnamon.
My skin is the color of caramel macchiato.
My skin is the color of rosy pearl.
Mi color de piel es como café con leche.
My skin is the color of cage-free, grade A, large brown eggs.
I'm a Fitzpatrick 2.
I am a Fitzpatrick 5'6".
Fitz 4.
Fitz 1.
Fitz 6. 4'5".
I love the color of my skin.
I love having healthy skin.
Fearless beauty, caring for skin of color with confidence.
Thank you. If you have any comments, questions, or discussion, please reach out to us at hello@fearlessbeauties.org.